Yes, good morning. First of all, I introduce myself, Dr. Abderrahim Oussalah, from the Department of Molecular Medicine and Gastroenterology from the University Hospital of Nancy and University of Lorraine Faculty of Medicine of Nancy. I am very happy to share our results during this meeting, and I would thank the organizers for their kind invitation. I will talk about a new potential biomarker for HCC diagnosis in patients with cirrhosis. And this marker is related to epigenetics, and so it is related to the assessment of the methylation level of the gene promoter SEPT9 in the plasma of patients with cirrhosis. I don't disclose any conflict of interest. This is my contact email. So I will talk about hepatocellular carcinoma, HCC, which is the most common primary malignant tumor of the liver with second ranking in annual cancer mortality worldwide, with a rate of incidence worldwide of more than 700,000 people. What are the major risk factors for HCC? Notably cirrhosis, HBV, HCV, alcoholic cirrhosis, and non-alcoholic steatohepatitis. And what is important to note is that a patient with cirrhosis has a 5-year cumulative risk of HCC, which range between 5 and 30%. And regarding the diagnostic aspects of HCC in cirrhotic patients, the alpha-fetoprotein is a widely used biomarker in the diagnosis, but also in surveillance. And however, both American and European Association for the Study of Liver Disease highlight the insufficient character of the AFP as non-sensitive and non-specific for a screening assay for HCC diagnosis. And for example, the EASL highlight that the AFP exhibits suboptimal performance for using as a surveillance test. Furthermore, if we see here in this very interesting study, we see that AFP is better in patients without HCV infection. So we could suggest that in patients with HCV cirrhosis, the AFP could not perform as well as in other patients. So why we were interested by epigenomics in HCC diagnosis? What is already known is that the epigenetic alterations, notably on DNA methylation, represent early events during carcinogenesis. And notably in the cirrhosis HCC sequence, it has been shown that the aberrant methylation of promoters of tumor suppressor genes are involved in this pathway of liver carcinogenesis. And in animal models, it has been shown that SEPT9 protein was dysregulated in a mice model of HCC. So what are septins? Septins are highly conserved eukaryotic proteins which are involved in the cytoskeleton, as we can see here in these figures, and they are involved in filamentous complexes and involved in cytokinesis, trafficking, apoptosis, and cell polarity. And more interestingly, the SEPT9 is involved in all this pathway, but also it has been suggested as a tumor suppressor, and it has been shown as being a partner of the lysine N-methyltransferase 2A. And on the tissue level, the hypermethylation of the SEPT9 promoter is associated with a lower expression. Here in this slide, you can see that in the normal colonic tissue, here we are not in the liver, but in the colon, no methylation at the promoter, normal expression. And here in adenocarcinoma of the colon, you have a high methylation level and no expression of the SEPT9 protein. More specifically, in HCC, this nice EWAS, the Epigenome-Wide Association study that was reported in Hepatology in 2015 on the hepatomic cohort, the SEPT9 hypermethylation was associated with a worse diagnosis in patients with HCC. And in this study, in this EWAS, 340 tissue samples, HCC and non-tumoral livers, were compared. So our working hypothesis was to check if there is a relationship between the SEPT9 promoter methylation status and the liver cancer status. So in patients with cirrhosis but without HCC, we assume that SEPT9 methylation is negative. So patients are unmethylated in this locus. But during liver carcinogenesis, perhaps due to chronic liver injury, the promoter will be progressively methylated, and when the cancer arises, the HCC arises, the promoter will be methylated. And this methylation could be assessed in circulating plasma of patients that exhibit cancer and who will exhibit this DNA with hypermethylation of the SEPT9 promoter. So regarding the methods of our study, we have designed a biomarker phase 2 study, which was a proof of concept study with two parts. The first part was the initial study in Nancy, France, and the replication study was performed in Halle, Germany, in total independence between the two centers regarding the design, the initial design. But we have we shared our results in this reporting. So the primary aim of the study was to evaluate the diagnostic accuracy of the mSEPT9 test to diagnose HCC among patients with cirrhosis. And the primary outcome of the study was HCC diagnosis according to AASLD guidelines, and all patients with an HCC had a confirmation of their HCC with abdominal CT enhanced scan, and were systematically discussed in multidisciplinary consultation meetings. Something which is very important is that the adjudicating physicians were blended to patients' results regarding the mSEPT9 test. Regarding the secondary outcomes, we had several secondary outcomes in this in explanatory manner. The first one was to identify the variables independently associated with the HCC diagnosis to account for potential confounders. Second one, to assess the accuracy of the SEPT9 test for early HCC diagnosis. The third secondary aim was to assess the accuracy in subgroup of patients with HCV and alcoholic cirrhosis. And the last secondary aims were to compare the diagnostic performance of mSEPT9 test with that of AFP, and to calculate the categorical net reclassification improvement of a SEPT9-based strategy in comparison with an AFP-based strategy. So the SEPT9 test was performed using the AP Pro CE kit with on DNA, bisulfite converted DNA on human plasma, and we performed that using the manufacturer protocol on a light cycler instrument type 1. And the results were considered as follows. The patient could have a triple negative test because we performed the test in triplicate. So if no of the triplicate is positive for the test, the patient is triple negative. If we had 3 triplicates positive, we considered that the patient was triple positive, and we could have also 1 positive or 2 positive triplicates. So regarding the results, between France and Germany, 289 patients were included, more exactly 186 in France in the initial study and 103 patients in the replication study. Both initial and replication studies were well powered for the primary outcome. So this is the descriptive results of the initial study with a comparison of 51 patients with HCC with 135 patients without HCC. The first important result was here. We have here the median number of positive triplicate in each group, and the median number of positive triplicates was 3 in the HCC group versus 0 in the control group, with a significant difference from a statistical point of view. Another point here is the etiology of cirrhosis. We had patients with HCV, alcoholic cirrhosis, NASH, HBV, hemochromatosis, and autoimmune liver disease. And interestingly, we see here that the number of positive on patients with a triple negative test were mainly control patients had mainly triple negative test or one positivity. In contrast, patients with HCC had mainly a triple positive test or at least two positive triplicate positive. Regarding the replication study, we had roughly the same results with the same descriptive pattern for the number of positive triplicates, with 0 positive triplicate in HCC in controls in patients without HCC, and 3 positive triplicates in patients with an HCC. The comparison was statistically different between the two groups, and the same pattern, roughly the same pattern from positivity of 3 positive triplicates, mainly in cases, and triple negative representing the main result in the controls. And here we have the area under the receiver operating characteristic curve in both initial. Here you have the results of the initial study, the results of the replication study, and here in the center you have the results from the meta-analysis of both initial and replication studies. We use the meta-analysis approach instead of pulling the data from the two studies in two aims. The first one was to estimate better the effect size, and the second one is to estimate the heterogeneity between both studies, initial and replication. And so the area under the receiver operating characteristic curve was 0.94, which was highly significant without any heterogeneity, with an inconsistency score of 0%. We have here the 2 point that estimate the bias. We have no bias in this meta-analysis. Another interesting point was that the calculation of positive here in red and negative predictive values, we see that the negative predictive value was very high in patients with triple negative tests, even on a large and broad prevalence of HCC. And in mirror, the positive predictive value was very high in patients with a triple positive test, even on a wide range of HCC prevalence. This interesting Bayesian analysis allowed us to tell that the test could perform well in several populations with a wide range of HCC prevalence. So regarding still also the primary aim regarding the diagnostic accuracy measures, here in this table we see that the mSEPT9 triple negative test has a sensitivity of 96%, a negative predictive value of 97%, and the mSEPT9 triple positive test for diagnosing an HCC has a specificity of 95% and a positive predictive value of 91%. The OROC was reported in the previous slide, and interestingly here you have the diagnostic odds ratio of this test, of this marker, with a triple negative test exhibiting an odds ratio for excluding an HCC of 54, and the triple positive test, in the other hand, for diagnosing an HCC, for retaining the diagnosis of HCC, which is very, very high at 91. So we have really a very high odds ratio both for excluding and for retaining the diagnosis of HCC at the individual patient level. Regarding the secondary aims, the first one was the diagnostic accuracy in patients with early HCC. We don't have patients with BCLC 0, but we have several patients with stage A HCC, and the OROC was 0.86 with a sensitivity of 87%, a negative predictive value of 97%, and a triple positive test exhibiting a specificity of 95% with a positive predictive value of 72%. But this is important because we have not designed the study for diagnosing early HCC at this stage, but we are planning to doing that in the first studies. But the study was not well powered. Regarding the diagnostic accuracy of the SEPT9 test in the subgroup of patients with alcoholic cirrhosis and in HCV, we have here the global comparison with of the SEPT9 performance in both initial and replication studies, and here in here you have the AFP performance, which is significantly lower in comparison with SEPT9. And interestingly, if you take the case of HCV-related cirrhosis, you have a very low performance of AFP. This is already known. We have seen this results previously in the first slides. But the performance of the SEPT9 in this subgroup is roughly the same that in the whole study analysis. So here we have the data on NPV, on negative predictive values and positive predictive values here. So for the triple negative test, you have very high sensitivities and very high negative predictive values. You see here the figures for the entire initial study, the HCV subgroup, the alcoholic subgroup, the replication, and in red you have the meta-analysis. And here you have the specificity and the positive predictive values in the same subgroups. And what we could retain is that the triple negative test is associated with the highest sensitivity for excluding an HCC diagnosis, and in the other hand, the triple positive SEPT9 test is associated with higher figures of specificity and positive predictive values. Final secondary aims regarding the network classification improvement. In this analysis, we compared two strategies. The first one was to use the SEPT9 as a diagnostic marker, using the threshold of at least 2 positive triplicates for retaining the diagnosis. And we compared this strategy with an AFP above 20 nanogram per milliliter as suggested in international guidelines. And when we compared these two strategies using the NRI analysis, the net reclassification improvement was 35% in favor of the mSEPT9 test. And finally, in the multivariate analysis, we assessed if the positivity of SEPT9 was associated with HCC even after adjusting for other confounding factors like the items of the child puke or the etiology, etc. So we found that the number of positive SEPT9 triplicates was the only independent variable which was significantly associated with the HCC diagnosis. And you have here the odds ratio for at least one positive triplicate, 6.3 in initial study, 6.07 in the replication, and in the meta-analysis, 6.15, with no heterogeneity between the two studies and no bias. We see here the funnel plot that show no study bias, and here the forest plot with no heterogeneity between studies. So what are the perspectives after having seen this interesting results? So the first stage, in the University Hospital of Nancy, we are working on a global project of HCC diagnosis using circulating epigenomics and epigenomics-based precision medicine. So the results that we have shown now were those of the proof of concept study regarding the SEPT9 biomarker for HCC diagnosis. And the second phase of this program was the prospective validation of the mSEPT9 test in a prospective study on a larger prospective study with 440 patients. And the trial was registered on nct.gov. And at this time, we have recruited 250 patients on the 440 that are awaited to be included in the study. The analyses are not initiated already. And the third step of this program will be the SEPT9 screen study, which is dedicated to the use of the SEPT9 test as for early identification of HCC. We will use for that a longitudinal cohort of 400 HCC-free cirrhotic patients, and the aim of the study will be to assess the accuracy of the mSEPT9 test for the early detection of HCC during the surveillance of HCC-free cirrhotic patients. This will be a prospective longitudinal multicenter study, and this is briefly the SEPT9 screen study design. And you have here, for each patient from the 400 HCC-free cohort with cirrhosis but without HCC, every included patient will be followed at the basis of every 6 months, so regarding the guidelines. And at every point, a clinical evaluation by an expert and standard biological evaluation, including AFP and a routine imaging, will be performed. And on that add-on, we will have a SEPT9 test that will be performed at every step. The hypothesis is that the switch of the SEPT9 test will precede the occurrence of an HCC. The primary outcome is the occurrence of HCC according to AASLD criteria, and the primary endpoint is the switch of the SEPT9 test from 0 to 1 or 2 or 3 positive tests. So this is just an example of a patient, for example, who is triple negative at the beginning, and during the follow-up he will present a double positive triplicates, and several years after he will present an HCC. And here, in the other hand, a triple negative patient who will maintain a triple negative status at the all follow-up of his disease during the 5 years without HCC occurrence. This is the concept of the hypothesis. So thank you for your attention. This work was performed with a very tight collaboration between the Nancy University Hospital and the Faculty of Medicine of Nancy and INSERM 1256 and the colleagues from Halle University. And thank you for your attention, and please feel free to send me an email if you have any question related to this data.